Um, Great. Well, good morning, good afternoon, good evening, everybody. My name is Ananda Grant, and I'm a director in the Humanitarian Technologies team at IEEE. I'm really pleased to welcome you to this session on this use case specific session today. Um, so if you have, we will sort of go through, Dr. Salah will go through the presentation, and if you've got questions, you can put those. I don't see a Q&A section here, but you can put those in the chat and we will sort of address those. I'll raise those questions at the end of the session and we can go through those. And so without further ado, I will turn it over to you, Dr. Salah, and I will put myself off camera and mute.
Thank you, Ananda. And for those of you on the presentation today, I'm Nené Salah, and I lead our activities on digital health and innovation at the UN Interagency Task Force Secretariat at the WHO. And I'm joined by colleagues and doing it in partnership with colleagues at the Ministry of Health in the Gambia from the NCD department. So I know we have Sefo Singate and Laminjai in the room here today as well, who will be around to support for any Gambian NCD related questions. Without further ado, I will share my screen so we can go through the use case. Are we visible?
Yes.
Yes.
Great.
Yes.
So for the purpose of this challenge, the use case is an AI chatbot for the prevention and control of NCDs in the Gambia. And the overarching mission and impact is really to empower individuals and communities through accessible and a personalized AI chatbot. Zooming in on the Gambia, the problem that we have is a rising burden of NCDs coupled with low awareness. So conditions like hypertension and diabetes are rising sharply, with almost half of the adult population with high blood pressure. Yet many Gambians still are unaware of the NCD risk factors until symptoms become severe, and they likely then have to present to hospital. The other challenge is their long travel times, their language barriers, although most of the population does speak. Although a good proportion of the population speaks English, the literacy rate is still very low. There are several other languages in the country as well. And clinic costs prevent timely guidance and follow-up. And there is still a good proportion of the rural population in the Gambia that is underserved. And there's that geographical disparity in clinical coverage as well. There are also behavioral challenges. People are aware of some of the risks, but lack practical and culturally relevant tools to change habits sustainably. So this intervention, this AI chatbot, will definitely have a huge impact through improved population health. It could potentially reduce the incidence of late-stage NCD-related complications thanks to accessibility and personalized health advice via a trusted digital companion. This would potentially also unlock cost savings through improved screening and consistent disease management, reducing late-stage complications and crises, and strengthen health systems by improving health system capacity for monitoring, outreach, and crisis communication at scale, but also reducing the burden of the health system by being able to screen out individuals who could potentially receive guidance and not have to present at the clinic, and so alleviating the burden on the health system as well. So for the use case requirements, you could scan the barcode to take you directly there. But looking at it in detail in the Gambia, it would provide accessible evidence-based health guidance to support the prevention management of NCDs such as hypertension, diabetes, tobacco dependence in line with the Gambia's national NCD strategy. And it would be designed for use on WhatsApp and other mobile channels to deliver personalized advice, behavior change support, and early intervention prompts. By reaching underserved communities, the chatbot will be able to reduce information gaps, promote healthier lifestyles, and ease the burden on overstretched health facilities. So the challenge would be to develop a minimum viable product that uses a RAG pipeline and open source software to provide conversational access to the provided knowledge base. Your solution should be able to ingest a corpus of documents, understand natural language queries, and generate accurate, trustworthy answers with citations. And the Gen AI Challenge fact sheet will provide you the resources that you need. I think I have a slide that talks on that as well. The task to address are the following: enhancing the baseline ITU GENIE.AI framework to tailor it to the Gambia use case, to be able to effectively integrate speech-to-speech capability, to be able to enhance user data security and make the chatbot safe to use, and integrate automated and personalized notifications based on user data and needs. So looking at one of our users, I believe we have three potential users on the Gambia portal of the challenge. But essentially, the risk factors and the things to address are fairly similar. So Bakari, for instance, is a market vendor from a municipality called Brikama in Gambia. And his goals are to understand what's causing his frequent headaches and dizziness, and to be able to find practical, culturally relevant advice to help him quit smoking and reduce his health risks, to be able to manage stress and adopt healthier habits without losing work time or income, and access trusted health guidance easily from his phone in a language that he understands. The pain points really are most health information is too technical. He doesn't always understand what it means for him. The clinic cost visits take too long. If he's supposed to leave his market stall to go to the hospital, that could potentially be a days of work and a day's loss in terms of money. So he cannot afford to miss any days of work because a day not being at his stall means he has no income. He's tried to quit smoking before, but has failed, and doesn't have anyone to provide him the support that he needs, or give him any reminders and support in terms of behavior change. And he's really not sure which other daily habits are harming his health. For instance, because tobacco dependence also is an NCD risk factor that affects other conditions, there are other potential habits that could be exacerbating his health. So looking at his user journey, so prior to having the app, so this is Bakari today. He experiences frequent headaches, dizziness, and stress, but he doesn't know why. The health information he gets is too technical and is not relevant to his daily life. He's tried quitting smoking, but doesn't have the guidance. His clinic visits are too long, disruptive, so it's not worth going to the hospital. This means that health decisions are when it's usually too late, so it's reactive, and he has to present to the hospital for something more severe than he would have if he had sought care in advance or had guidance earlier. So now that we have the chatbot, which is your innovative solution, Bakari opens this AI chatbot on his phone and gets an easy-to-use interface that understands an assessment of his lifestyle and risk factors. He can enter a prompt, something simple, such as a question about to ask why he's feeling the way he is, and he will get back some guidance in a simple local language that explains uh, uh, that provides explanation relevant to how he's feeling, his work, and his habits. It could potentially create a tailored quit smoking plan, identifying triggers and suggesting realistic replacement habits to ensure that this could be sustainable. And uh, another thing is the ability to do this in a timely manner. So instant advice, daily tips and reminders without him having to leave his market stall. This means he will not be losing out on time and money. Bakary is now receiving continuous proactive health support, empowering him to prevent complications and maintain long-term wellness. So your toolkit is mainly uh, consisting of the relevant resources if you scan that barcode, but essentially the data that you will need, as I mentioned, you have a corpus of resources. So you have handbooks from the Be Healthy, Be Mobile initiative, which is a WHO and ITU initiative, with guidelines uh, on on mobile messaging for, I believe, hypertension, diabetes, curated WHO message libraries, WHO guidelines on the NCD conditions and risk factors. And we also have a Ministry of Health guidelines so that it's more tailored to the Gambia. So it will be a mix of PDF and Excel files. And these are available on Confluence from the barcode. The solutions must not write back to the original data source. And the languages see the GENIE.AI framework, as well as for the AI and RAG frameworks, and the following as well, the vector database and the LLM API. We are here to help you succeed. Your success is really our success. This is a potentially really impactful solution that will be deployed on the ground to impact the lives of people. I believe in terms of comms, IEEE will provide the details. I think you've already provided the details, Ananda.
Yeah, I just put that in the chat. There's a form if you want to submit questions. So I've just put that in the chat so it's easy to access.
Okay. And so we're happy to answer any questions here, and we will be available for dedicated Q&A sessions later this month and next month. And I am your point of contact along with my colleague from the Ministry of Health, SAFO, in terms of the NCD space, and the technical mentor will be Roman from ITU. Yeah, with that, I will hand back over to you, Ananda.
Yeah, so if folks want to send me, the Q&A button is not showing up for some reason. So if you want to send me any questions that you have in the chat, you can go ahead and do that, and we can pose those to Dr. Salah and her colleagues. The way that this Zoom is structured is not everyone has access to sort of for audio, so that's why we're using the chat. So if you've got, again, if you have any questions that you want Dr. Salah or Dr. David Manset or myself or anyone else to answer, please go ahead and put those in the chat. And if you have questions again after this time, we do have okay, I have one question. So there's a question about what the GENIE.AI framework is. And so I'm going to pass that to my colleague, David.
Thank you, Ananda. So as part of this challenge, ITU is supporting the participants with providing a full technical framework to facilitate and accelerate the developments. It's an open source framework that we have been producing and coordinating for the last 2 years, which the purpose of which is to make it easy for anyone to embark utilizing open source LLMs combined with RAGs, with retrieval augmented generation. That is a technique in artificial intelligence to allow fine-tuning quickly an artificial intelligence to a given corpus of data. So this is presently the case, as Dr. Nené indicated. You will be provided with training data sets coming from WHO. You may also use additional training data sets, provided they are accessible for free and open. And you will use that to fine-tune your artificial intelligence as part of this challenge. So GENIE.AI is just a layer of abstraction that provides you with the means technically to connect an open source LLM and to use it as part of a harmonized framework. It also provides some graphical user interfaces and easy APIs to develop new chatbots, to integrate any other functions you would like your application to provide the users with. So we'll have a session tomorrow, same time on Zoom. So please register using the website. There is a link. Because we will provide an extended explanation on the GENIE.AI technical framework. So we'll give you all the necessary means to get started. So to create your own application, to plug in your own LLM, to use an existing LLM, and to very quickly get started. So my colleagues, Roman Chesnov, but also David Forden, will be supporting access to the technical framework. And so we'll be glad to provide you with any support and answers you may need. Beware as well that we will, all of these developments, as they will be open source, will be made available through a UN repository of open source software. So we will provide you with all of the guidance to commit your source code, to create teams and branches under this repository. Over to you, Ananda.
Thank you so much, David. Are there other questions? I think I'm going to go ahead while if there are not any other questions, I think I'm going to go ahead and show you all, and I'll be checking the chat just to see. This is the link to the website that I just put into the chat. And in the intro to this session, I think our board chair also referenced this area, right? So this has a lot more information that you can reference after this call, and this is specific to this use case, right? So there'll be kind of the requirements that Dr. Salah went over, more information here, information to create an application and submit that. This is the page that you'll this web page is probably what you'll want to bookmark, right? So there's that resource hub that's going to have lots more resources for you that we'll be adding to. And then these FAQs, which we will continue to add to as we see questions coming in from interested participants. We will make sure to obviously answer those through the form that we referenced in this chat, but also add more questions onto the Q&A, right? So please bookmark that. That'll be a good resource moving forward. So I'm just checking the chat again. I don't see any other questions. I just wanted to ask again if there are other questions, or Dr. Salah or David, or I think your colleague was here as well, Dr. Salah, anything else that you think you might want to highlight? Again, as Dr. Salah mentioned, there'll be some additional sort of opportunities to interact, to learn more about this use case in the future. We will be sure to share those, but just want to turn it over to either of you to see if there's anything else you'd like to highlight.
Yes. No. Nené, do you want to proceed? Sorry.
I mean, I guess at this stage, nothing critical, but just to remind people who are participating that the webpage that you shared is really resource rich, and to go through the use case requirements, as that would be a really helpful guiding resource. And we're happy to take on any additional questions should you have them. Over to you, David.
Thank you, Nené. So I just wanted to add to what Ananda said, that so we are expecting quality developments. You may want to team up and not go just alone applying, because there may be other competencies you may want to involve in your project. So we are really looking forward to teams coordinating in these developments and coming up with really challenging and innovative solutions. Do not be afraid by the fact that there is a technical framework to harmonize the developments. It's really a simple one. You will have a chance to add up as many as you want, as much stacks you would like to, provided it's open source and we can deliver the whole thing as part of the challenge, truly open source. You are free to integrate all resources that you may feel are pertinent to your developments. So I'm looking forward to tomorrow's info session, because you will have a chance to discover more about GENIE.AI and have a better feel on how this will integrate with your ideas. We will be here to support. Don't hesitate if you have any questions. We'll certainly organize additional sessions for those selected to actually go into much more details when the developments will be carried out. Over to you, Ananda.
Thank you very much, David, and thank you, Dr. Salah. And yeah, I just want to thank all of you for joining today. And I think it's clear there's, we've given you sort of an intro, but there's so much more to learn, and we hope that you'll join the session tomorrow and put together sort of teams with a cross section of individuals, as David mentioned. And again, please just bookmark that page, reach out with questions. We look forward to hearing from you and to providing more information. With this, excuse me, if there are no more questions, we will close out the session. There's no need to sort of go back to the main room. Everyone is sort of in their existing breakout rooms, and we'll then sort of close for the rest of the day. I see a couple of folks have just joined. I think Benjamin and Midhala. I just wanted to let you know that we are closing the session, but we will be posting information on our website, and feel free to reach out if there are other questions. And we really look forward to yeah, you all sort of joining the challenge. It's a really exciting. We're really excited that you're all here, and we're happy to kick things off. So with that, we'll say have a good rest of your day, and we will look forward to seeing you tomorrow and in the future. Thanks again.
Thank you. Bye-bye.
Thank you very much.
Thanks, David.
See you next week. See you tomorrow.